China's population is aging. By the year 2050, it's estimated some 330 million Chinese will be over the age of 65. For some insight, let's bring in Dr. Xi Chen. He's Associate Professor of Public Health at Yale University. Professor, 65 isn't really considered elderly these days, I don't think, and people expect to live much longer. As we saw from that dating show, they want a quality and happy life. So explain China's aging trend and what led up to that.
Yes, thanks for having me. Population aging has been a global trend. So it's manifested in two things. One is people living longer, and also they have fewer kids. So the trend is accelerating, and the number of older adults in China is even more than like US, Japan, France, Germany, and Italy combined. So given the size of the population in China, and also the rate has been very high of aging. So by the latest population census just released last year, 13.5% are above age 65. This is by any means means that China is already entering into the aging society, and by 2050, the ratio will be around 1/4. That means about more than 27% of the population will be above age 65. But this may cause damage to many levels. At an individual level, there's a concern about the disease management, especially chronic conditions. And at the family society level, there's a lack of need care to supply as a long-term care. And also as an economy, there's a concern that there would be less of investment because when people get older, they consume more than they save. And there's a lack of innovation, as we know that young adults may have more innovative ideas. And also this may comply with lower economic growth. So those are the concerns.
So that being said, what is the government doing to address the senior population, their health and welfare, as well as they continue to age? As you mentioned, it all comes at a cost, a financial cost as well.
Indeed, and I think the main issue is health and economics. The health issue is that, as we know that when people get older, they have more disease burden towards chronic conditions, no longer like acute disease. For example, Parkinson's disease, Alzheimer's, dementia, those are chronic conditions. They demand more care and they become more costly. And the Chinese healthcare system is more hospital-centric system. So it has to be reformed into more primary care-driven system to empower the localized care and the disease management. And in economics aspect, the pension and retirement policy are the key. So China, starting from 2009, already rolled out the nationwide pension program for rural population, then expanded to urban population. That's the largest pension program in the world. And now they also try to enhance the individual account for employee-based pension. And also the retirement policy has to be changed because people are living longer, so they need to consider to retire later. So there's a debate about how to raise the retirement age to try to rebalance the consumption and income at old ages.
We have about 15-20 seconds left. Professor, we talk about this older generation, but what would you say is their biggest concern? If you talk to senior citizens in China, what is their one big worry?
Yeah, I think the big worry is that there's a low birth weight, which comply with people living longer. This will drive the population profile into more aging people and even fewer young people. So I think to address this issue, the policies need to reduce the burden of childbearing, including the cost to the women, their career, their mental health, and also to improve their financial conditions. For example, housing market, education market need to make them more affordable to the young couples.
All right, Professor Xi Chen, always great to see you. Thank you so much for joining us and happy holidays. Still to come, bring